Okay, this might be my cue. Can you guys hear me? Okay, perfect. My name is Jen Malone, and I am one of the co-chairs for the Fall DEI committee for the class of 2021 Centurions program, and really had a great time helping to put this symposium together. I have the privilege of introducing our speaker for this breakout session. As you may have figured out, there's 4 different groups that we're in, and so this is 1/4 of the people participating in the program today. But today we're going to introduce, I'm going to introduce Dr. Khan, the Chief Executive Officer at the Samuel Rogers Health Center. And we're going to talk about COVID-19 and its impacts on communities of color. So thank you, Dr. Khan. Really are glad that you're here to join us and look forward to listening and learning and then having some small group discussion throughout our session today.
Thank you very much. I appreciate it. Let me just begin by expressing my gratitude to the entire group for putting this together. I know what a logistical and technological challenge that it must be to organize something of this complexity. It goes without saying that over the last year and a half, we've seen an acute exacerbation of the issues that confront communities of color every single day in the greater Kansas City region. That's putting it mildly. I'd like to take you back, first of all, to the pre-pandemic era. Let's put it at December 31st, 2019. At that point in time, there were entire swaths of zip codes along the Troost corridor extending from North Kansas City all the way down to pretty much the Plaza and Westport area and even further south that were disproportionately impacted by a variety of things: generational poverty, a lack of transportation, housing prices that seem to be not in consonance with the rest of the market, to put it politely. Property taxes that seem to be disproportionately burdening those communities in comparison to others. And you will remember the great property assessment kerfuffle of 2019 with Jackson County and the consternation it caused. And on top of that, you had school systems that really were seriously challenged when it came to resources. No lack of effort, no lack of talent or leadership or desire to excel, but systems that were really struggling with resources to take care of all the kids in their fold. And that is important to remember precisely because the first 5 to 10 years of school life really set the stage for an upward trajectory of health status indicators, not just educational indicators or economic indicators, but health status indicators fundamentally. And that's where the maximum amount of investment needs to be made to sustain that upward trajectory. To some of the more affluent suburbs and school districts, that may be an alien concept because they've really never had to worry about it. But for the Kansas City, the public school district here, as well as the North Kansas City Public School District, that is a challenge on a weekly, monthly basis. With that in mind, I want to remind everyone that we really were not in a good place on December 31st, 2019. We had a lot of work to do. Then came the pandemic and the systematic breakdown that occurred in critical services, beginning with schools. Why is that important? The meals that those kids received, a large portion of those kids received at school, was probably the only guaranteed stable meal that they had during the day. And so food insecurity played a large part. Upwards of 40% of the children enrolled in the public school district here in Kansas City experience a change in residence and have to change schools during any school year. That is a sentinel indicator of housing insecurity. They bounce around, and as a result, their development is stymied. The resources that they depend on to thrive get taken away from them. And so there was a complete disconnect at that point in time. I remember being on a conference call with the superintendent, Dr. Mark Bedell. He is an amazing individual, a force of nature, in my opinion, for positive change. And Dr. Bedell was very passionate in advocating for food distribution, at the very least, to sustain families and children through the darkest parts of the pandemic, going back about a year. And we really ended up using our health center as a food distribution point at one point in time. And then, of course, they found other solutions. But you will remember that about a year ago, they were using school buses to go their normal route and distribute food. That's how bad it was. And it hasn't improved much since. The switch to online learning might be the easiest of things to do for my children or those from more affluent families. But Wi-Fi availability or internet availability is not a guaranteed deal for a lot of families. And that was another major component of this. There's a large swath of our population, mostly in communities of color and the African American and Hispanic communities, but also some white communities that really don't have reliable, dependable internet services. And that's a major deal because it really severs their digital link to society in the middle of a pandemic. Another point I'd like to point out to you is the fact that evictions and homelessness went through the roof in the middle part of 2019. And this is despite the so-called federal and state bans on evictions, etc. We all know that those are only as good as the paper they're printed on, because the enforcement end is always lacking. And so we were in a situation where if you walk down Independence Avenue from where we're located, you would see perhaps one or two homeless people on the corner at the intersection of Paseo and Independence. Now you can go out there and see 20, maybe 30 people every single day. That's just a very small window into the extent of the problem. So with that in mind, once the pandemic began to roll out, what was the first thing that happened to a health center like ours? We had to shut down our clinics because there was panic, as you will remember. All dental procedures were canceled because they generate the maximum amount of aerosol, which means that adults and children who desperately needed dental care had to go without it. We had to shut down our clinics because we weren't sure about infection prevention and control protocols. So little was actually understood about disease transmission at that point in time. Is it aerosolized? Is it fomite surfaces? Is it door handles? Is it desktop surfaces, etc.? What are the cleaning protocols that we need to put in place? How do we screen people getting into and out of the building? So it was panic stations for a while. And this was the picture nationwide. The worst impact of that fell upon the 14 to 1,500 individuals that we see in our health center who have chronic diseases. People who are older, 65 plus, people who have coexisting conditions, diabetes, cardiovascular disease, renal disease, atherosclerosis, pulmonary disease, you name it. Those were the people that needed to get in to see their primary care physicians at least once a month for management of their illness and for prevention of complications. Well, lo and behold, when those individuals go without having to see their physician for 2 to 3 months, their health status indicators drop like a rock. It is easier said than done that when you open your clinic back up, now we're talking late May, June 2020, all those people will just come flooding back to seek care. No, that ripple effect of fear across the community prevents them from picking up the phone and walking into the clinic because COVID is out there and it is a justifiable fear and very little is understood about it. People are reading the same headlines that you and I are privy to about hospitals being full, people being put on ventilators, not coming out of ventilator-induced comas, etc. And so people began to forego the opportunity to seek primary care. That meant that somebody who was pre-diabetic in January 2020 ended up being diabetic with an out of control blood sugar and and high A1C levels by June 2020. Multiply that by 1,500 and you get the picture. Now you're not just preventing disease, you're dealing with the aftermath, complications, etc. That is the picture that we saw at Sam Rogers. That's the picture that our counterparts at KC Care and Truman Medical Centers and Swope Health Services saw. Consider this. Our healthcare system is so messed up structurally that even in the midst of a pandemic, when people are literally one medical bill or utility bill away from bankruptcy or being destitute and having to make choices between paying utility bills and being able to afford food, our healthcare system did not back off of billing people. And so we had patients that we had to fight for with the various hospital systems, et cetera, to try and waive off some of their admission costs for various illnesses, including COVID. I cannot begin to describe to you this perfect toxic mix of factors that came together to create a picture that is now looking very muddy indeed, even with the advent of the vaccine. And I keep telling my colleagues this, the true impact of this pandemic will not become evident until 2 or 3 years post-pandemic. Once everyone is vaccinated, once we've got the pandemic controlled and it's been confined to the dustbin of history, hopefully soon, knock on wood, we will begin to see just how devastating it has been to families, to children, to senior citizens who are trapped in their own houses and unable to seek care or the support services they so desperately need. Our effort as a not-for-profit community health center.
Pelican Protocol Lab, Women's Health. Pelican Protocol Lab, Women's Health Provider.
Sorry about that. That's the overhead paging system whenever there's an emergency. Yeah, so where were we? So yes, the true impact of the pandemic will not become evident for at least 5 years post-pandemic once we begin to tally the data coming out of different communities and looking at peer-reviewed information to determine what went on in different zip codes and different communities and different strata of society. The breakdown in social support structures for our communities that are already vulnerable is not even something we're beginning to fathom at the moment. People that relied on friends and relatives for transportation to and from services they desperately need have been left out on their own. Yes, things are beginning to improve marginally, but nowhere near the speed with which we need to be recovering. And that remains my greatest worry. The vaccine represents hope, yes, but within the vaccination effort, what is lacking is a conscious focus on what I would call vaccine equity. Communities of color, both African American and Hispanic, are being left by the wayside. There is a lot of mistrust, most of it justifiable, some the result of history and the burden of ugly history, Tuskegee and so forth, that really have resulted in a disconnect between science and what is available in terms of therapeutics and preventive diseases, disease prevention strategies, and what is made available to different communities. And so unless there is a focused federal, state, local effort to try and reach out and build trust and promote the uptake of vaccine, this effort will fall flat on its face. The best of vaccines is the one that people actually take. Otherwise, you can have 500 million doses sitting on shelves and it won't make a difference. We are still a long way away from that. That really worries me. An indicator of that is the fact that at Sam Rogers Health Center, we're very proud of the fact that we have a diverse workforce. 20% of our 250 employees were patients of the health center before they chose to become employees. 60% of our patients are best served in Spanish. We have a total of 42 languages spoken in our patient population. We make every effort possible, and in fact, it is a strategic priority for us to recruit from the communities that we serve. So we actively seek out and target for recruitment African-American physicians, Latino physicians, people who are multilingual. It may come as a pleasant surprise that 3 out of 4 of our African-American physicians are actually bilingual, fluent in Spanish and English. So, that really helps us deal with this. But even with that mix in place, it's going to be a challenge to serve the needs of the community around us. And I don't see that situation improving in the short term. It will require sustained financial investment, only the kind of investment the federal government has the wherewithal to make, because the state of Missouri spends a grand total of $6 per person per year on public health services. I'll repeat that for you. $6 per person per year. What is the average state spending on public health services per person per year? Take a wild guess. $33. Missouri, $6. Everybody else, on average, $33. We are 50th in terms of public health spending per person per year. That's not just shameful, it is criminal in my book. And please feel free to quote me on this to anyone, because I firmly believe that you get what you pay for. And it is really up to us, the people who live and reside in Missouri and love residing in Missouri, who are taxpayers, to vote and determine those priorities. We have chosen that situation for ourselves because we haven't prioritized public health. Well, there is no better opportunity to demonstrate the desperate folly of that choice than this pandemic. I'd like to point out to you that expecting an A+ response from a system that is chronically underfunded at a D- level is a mistake. And that has been the situation in Missouri and many other states now for the past 25 years. So unless that improves, the whole milieu of social support services necessary to sustain our communities and help them weather this storm will not improve. I'm going to stop there and open it up to questions so we can begin a dialogue.
Thank you, Dr. Khan. I put in a few questions into the chat, and what we were planning to do for the next 10 minutes or so is kind of break up into smaller groups. Those questions in the chat are just some conversation starters, so don't feel as though we have to follow those, but Caitlin is going to help divide us into smaller groups. In that time, please talk amongst yourselves, ask questions, have some dialogue, and then we'll come back for 10 minutes or so and direct some questions at Dr. Khan. But thank you so much for your insight today.
Thank you. It's a pleasure.
All right, well, I think we are coming back, so hopefully the rest of us will be in the room together here briefly, or not briefly, but in a moment. Dr. Khan, I'm gonna move over back to you to take questions. If you guys have questions, go ahead and put those in the chat, or I don't know, like do your little raise hand icon and unmute yourself, and you can ask Dr. Khan directly. But please go ahead and ask any questions you might have for him or any thoughts you have from your time in your breakout.
Okay, I'll go first. Dr. Khan, thank you so much. My name is Andrew, and in our breakout session, we basically share the same sentiment of not wanting to be, a standby and see things happen and not do anything. And the weight of the statement you made of 5 years from now would never know the impact until of the pandemic until 5 years from now. So my question is, we have organizations that that are similar in nature but different in its outlook or outcomes. What would you say, or how would you recommend for organizations like nonprofit that focuses on children and youth? What would you recommend for us to kind of join forces, join resources together to do something that is both short-term and long-term impact and outcomes? I don't know if my question is clear, but that's the nature of my question.
No, and you've just hit upon a very good point. One of the things that it seems to plague most metro areas, Kansas City is no exception, is that a lot of agencies and a lot of organizations are trying to do good work, but they're doing it in piecemeal fashion without connecting with each other or realizing that they're tripping over each other to try and serve segments of the same population without a sort of a joint, hymnal in front of them to follow. And so, there really is some need for a unified platform. Now, I'm not suggesting that, we reinvent the wheel necessarily, but if there are any colleagues, for instance, from United Way, for instance, that are online here, I would challenge you guys. I look to the United Way as a tremendous resource directory and repository. One of the needs that will arise, as the question pointed out, is to get social service agencies connected with each other on the same platform so that they can share resources and not double dip and not, try to really trip over each other for pursuing the same dollars in funding. Yes, it might lead to some administrative integration as well and merging together in the years ahead. That is fine. That's a good outcome. It's not a bad outcome to have, but there needs to be a unifying platform, a coordinating platform of some sort, and that will become apparent, I suspect, in the year, maybe 2 years ahead. Right now, most of us realistically are in survival mode and sort of focused on the pandemic and getting past it, etc. But your point is very well taken. We really don't need 200 agencies trying to do the same thing. We only need 20 agencies that are focused on 3 or 4 aspects of social services.
Awesome. Thank you so much. Anyone else have another question for Dr. Khan?
Yes, I have a question for Dr. Khan. You touched bases on the food insecurities and the evictions and homeless being increased over this COVID time. Have you seen the numbers jump drastically because of COVID? And do you see that improving once COVID kind of takes a decline, hopefully here soon? But do you see it dropping, or do you see it maintaining at that level, or do you see it increasing?
That's a good question, Aisha. And to be fair, that trend was beginning to emerge pre-COVID. It was true as of December 31st, 2019. And once the pandemic hit around March of 2020, it kind of became steeper. And so I don't see it easing off in the near term, certainly. We are seeing a dramatic jump in patients that are showing up and reporting housing insecurity or asking for assistance related to rent, related to utility assistance, etc. People who are facing eviction. And so, enforcement is difficult in that realm. There aren't enough resources within law enforcement, etc. The federal government can sort of impose a ban on evictions all they want. What actually happens in suburbs and housing complexes is very different from reality, as we well know. And once again, it is communities of color that are disproportionately hit. I would venture to say 90% of the true impact is on communities of color. I don't see the trend in increasing housing insecurity easing off until at least 2022, at the very earliest, if that. the way we are proceeding at the moment in terms of vaccination and trying to get back to some semblance of normal, we might be at the end of the first quarter of 2022 before we have some sort of herd immunity. So it's reality. Somebody just asked a question about what goes into the $6 per person per year compared to the $33 per person per year public health spending. So that is a mix of services, and that report, just for your reference, Gretchen, was prepared by the Missouri Foundation for Health. If you go to their website, mfh.org, they have that report there. That $6 is calculated, so they take each dollar and break it down into cents. You know, how much is allocated for immunization services, women, infant, and children services, environmental health services like food and dairy inspection and restaurant inspection, environmental cleanups, etc. So they take that entire gamut of public health services, divvy it up by cents, and then try to calculate that cost per person per state. It is a pretty comprehensive analysis, and that calculation has been borne out to be true for Missouri, regrettably. Follow-up to that was Amelia, I think, asking about follow-up saying, how can we advocate to increase that spending? Every chance you get when you meet a Missouri state representative or legislator or governor's team or staff or the governor himself or the lieutenant governor, whoever it may be, ask them, confront them. Why is it that Missouri spends $6 per person per year, whereas the average state spends $33 per person per year? Is that the priority you've placed on the health of Missourians? And if there's a flicker of anger in my voice here, it is deliberate, because this really is about you and me and our children and their children's children. And it is a shameful situation to be in. There is no rhyme or reason for it. And I would add to that, you saw the voters in Missouri approved Medicaid expansion last year. That is a big deal. People would have bet against a conservative state like Missouri going that route and voters approving that. But you know what? People realize that healthcare is important to them, regardless of where their political affiliations may lie, whether they identify as conservative or liberal or what have you, or centrist. People know that they want to have access to physicians and not have the threat of going bankrupt hanging over their necks every time they need medical care. And so that is why they voted to expand. And they also saw the economic argument for that, by the way. And our chamber here in Kansas City was a strong advocate for Medicaid expansion because it made perfect economic sense. We send upwards of $1 billion of our taxpayer money outside the state to other states that have expanded Medicaid. We should keep that here, fund our rural hospitals, bring more Missourians into the Medicaid fold so that they don't have to worry about paying for basic primary care, both medicine and dentistry, whenever they need it. Right now, we're looking at about 220,000 more Missourians being able to be covered by Medicaid as a result of this expansion. And the legislature is going to consider and move on it by June this year, hopefully. The governor acknowledged it in his State of the Union address yesterday, I think. And so it is a big deal. It's something to keep an eye on because it is directly tied to poverty alleviation, and to improving health status indicators. And it should matter to each and every one of you.
It looks like we've been extended for a few more minutes. Does anyone else have any other questions to ask? This is a great dialogue. You know, I'm curious how we get people to start going back to the doctor. I mean, I don't know. Do you have any ideas on how we promote that?
Well, I think just, you know, using whatever bully pulpit or message board or blog or venue that we have to say, you know, healthcare facilities are back open. Physicians and hospital systems are now better trained in terms of managing COVID, for screening for it, as well as treating it. One of the reasons the fatality rate from COVID has declined, and you know, I say that guardedly, even as 3,000 people are dying per day, because if nothing had improved, we'd be looking at 8,000 to 10,000 people dying per day. is that we now better understand the management of COVID. If somebody presents in a hospital and they need to be intubated, et cetera, or treated, we have more diagnostic and therapeutic devices available to us. But it is important that people come back into the fold of primary care, keep those appointments that were rescheduled or canceled or missed, go back to the dentist. Everybody is fully aware of it. Everybody is practicing infection prevention and control guidelines, and those are required now by licensure. So you have no rhyme or reason to worry about going into the doctor's office.
Perfect. Anyone else have a question? Sorry.
I would just, this is Gretchen. This has been so informative, and really appreciate your time, Dr. Khan. But what, other than talking to our legislators, what else can we do to help through our organizations or personally? What can we do?
You know, my experience has been that legislators, politicians, particularly in a state like Missouri, tend to listen to the business argument, the money, the dollars and cents, more than the healthcare or social needs arguments. And I don't mean that as a compliment necessarily to them. It is important for chambers of commerce and industry, for individual businesses to highlight the fact that they want a healthier workforce, and to make the argument in terms of, if you invest more than $6 per person per year, you save $50 per person per year in terms of the management of complications. And actually $50 is conservative, it's probably in the hundreds per person per year in terms of complications. So keeping people healthy and healthier in their own homes and communities is not just a social and moral argument, it is a huge economic argument. And that begins with the business workforce. A business with 5 to 10 employees should worry about the health of those 10 employees, because their healthcare premiums, the insurance required, is going to go through the roof if one of them has a chronic disease that is poorly managed.